Good morning, friends. Welcome to our next learning session. And today I am going to tell you the effect of smoking on your bone health. This is a very important thing, and you should pay attention to the gist of this talk I have brought out from the literature for you. Look at this diagram to understand the bone. This is the bones of the lower limbs where it joins with the main trunk of the body. Look at what is this. This is the hip bone. This is the hip bone. This is the hip bone. Both sides. You can see the hip bone, and this is the head of the femur. This is the, we call it thigh bone. This is the thigh bone. Remember, this is the all thigh bone. Starting right from this portion, it is the thigh bone. This is the thigh bone. Again, I will mark it out from the here. It is going like this. It is going like this, and going like this. This is all thigh bone. This is the thigh bone. Now, thigh bone has got some important parts. This is the shaft of the thigh bone, that is the shaft of the femur, and this is a protuberance on the shaft of the thigh bone is called greater trochanter, and this is narrowed portion is called the neck of the femur or neck of the thigh bone, and this rounded portion is the head of the thigh bone. Now, why this portion is rounded? Because there is a depression in the hip bone here, which is we call it a cavity, and this head moves in that, and due to this movement of this head in this cavity, we can walk, we can turn our leg and to the left or to the right and raise our leg. All the movements are done because of this head. This is similar to our shoulder. Shoulder and hip are similar structures practically. The shoulder is in the upper limbs and the hip is in the lower limbs. Now, so you have seen that this is a head of the femur, this is the neck of the femur, narrowed portion, then this is the shaft of the femur, then you have protuberance on the shaft of the femur. This is called greater trochanter. You have a small protuberance inside the inner side of the bone. This is called lesser trochanter. See the other diagram and what you see in this diagram. See, what is this showing? This is the showing you normal trochanter. Again, the same things. This is the shaft of the thigh bone. This is the thigh bone, shaft of the thigh bone, and this is the head of the thigh bone. This is the head of the thigh bone. Can you make it out? This is the head of the thigh bone. This is the head of the thigh bone, and this is the greater trochanter. You see, this is the greater trochanter. This greater trochanter is normal, but what about this greater trochanter? This portion is broken. So this is called trochanteric fracture, or for all your purposes, this is the fracture of the thigh bone. This is where located. This is the job of the radiologist to tell, and it is the job of the surgeon to treat it. You are not to bother about where it is located, but for you it is the fracture of the hip bone. Now, after having told you about the basis of this hip bone, I will now tell you how the bone is formed. The bone is formed by certain cells called osteoblasts. These are bone building cells, and calcium is also resorbed from the bones by another type of cells called osteoclasts. So there is a balance struck between the removal of the old bone, old calcium, from the bones and deposition of the new calcium. New calcium is brought from the intestines into the blood and from the blood into the bone. Vitamin D3 is a very important constituent for this purpose, for the absorption of calcium from the intestines and then deposition of calcium in the bones. But estrogen hormone is also very important for bone health. If there is a person is smoking, it is going to reduce the levels of estrogen hormone. Smoking also reduces the blood supply to various organs of the body, inclusive of the bone, and this smoking slows the production of osteoblasts, that is bone building cells in your bones. As I said before, smoking also decreases the absorption of calcium from the intestines. There is also now known that the smoking can delay the healing of the fractures. It can increase the chances of infection in your body in general, and as well as the bone. So friends, I am not telling you the mechanism how this happens, because then that becomes teaching medical students. You and I both know that becomes very difficult to even understand. So friends, here you have seen that how the bone is used. A gentleman came to me, aged, he was 70 plus, or I should say 75 plus, and he had fracture of the thigh bone. Which part of the thigh bone? As I have shown in the diagram, it was the greater trochanter. But I tell you, the most common fracture of the thigh bone is the fracture of the neck of femur, that narrowed portion of the thigh bone, which makes typical history of the patient is an old person, old female, goes to the bathroom to take bath, slips and falls to the ground. She cannot get up, she is brought out, and it is found that she has got fractured neck of femur. This is typical history. Medical students are given these cases in the examination, and they are supposed to make diagnosis right from this history that they are going with a case of fracture neck of femur. But we are talking in general, the smoking can suppress the activity of osteoblasts, and therefore the bone building is decreased. The calcium absorption from the intestine is decreased by smoking. The infections are more common in those who are smokers, and the healing is delayed in those who are smokers. So friends, smoking is bad in every respect. You know that smoking can cause heart attacks. You know that smoking can raise the blood pressure, and here I have given you another reason for quitting smoking. So friends, now remember this lecture when you are going to start your next cigarette, that how much harm you are going to do your body. I am not talking of the chronic bronchitis or hyperinflammation of the chest which it can cause. I am not talking about the other things, but certainly yes, it can affect, smoking can affect your immune system, and that is why your infections are more common, and their clearing is also less common because of smoking. So friends, thank you very much for listening to me. We will next time pick up another useful topic and try to tell you more about that topic. Thank you very much.